As a healthcare provider, maintaining accurate and up-to-date clinical records is a core part of your role. Good records help patients receive the best care possible across a team of healthcare providers, and they support us to make decisions about cover or requests for services. So, let's take a look at the basics of providing clinical records to us. We use clinical records for a number of reasons. They help us to determine whether we can cover an injury and whether we can fund additional support or treatment, such as surgery, pain management, weekly compensation, and home health. Sometimes we may request your clinical records to make sure the treatment you're providing meets our requirements. As a healthcare provider registered with us, you have certain responsibilities when providing treatment. The services you provide and invoice us for must be for a covered injury. They should be necessary and appropriate to treat the covered injury and be of the quality required. These services must be supported by clinical records that meet our requirements and the standards of your professional body. To help us provide the right cover and support for someone who is injured, it is important clinical records have the following information: the relevant claim number, details of the accident event to help us understand the cause and nature of the injury and include the force where appropriate, the diagnosis of the injury including any differential diagnoses, your treatment plan, and if using time-based billing or invoicing, record the time taken. While writing good quality clinical records is part of every healthcare provider's role, there are some things you can do to help us make faster decisions. If handwriting your notes, ensure they can be easily read. If using a practice management system, make sure you update your notes to reflect the latest treatment session and avoid copying and pasting your notes from the previous treatment sessions. Ensure your treatment is documented in a manner that can be understood by another clinician. State how effective your treatment was each session by using an objective measure pre- and post-treatment. Tolerated treatment well, for example, does not give an indication of how effective the treatment was. And finally, include your goals for your treatment and how you will measure these over time. So, there you have it, the basics of providing clinical records to us. Thanks for watching.